Welcome to Unpacking Project 2025 Implications for Reproductive Health Care. I am so looking forward to this information because we want to dive a little bit deeper into our understanding of this beyond the sound bites, beyond the memes that we've all shared. I know I have to, because who wants to read that 900 plus page document? Well, lawyers do. And so that's why I invited a couple of lawyers that Desert Star works with in our advocacy work to help us really, get down and understand what's in that 900 plus page document that impacts us as people who need healthcare, reproductive health care, and those of us who also advocate and provide that care. And so I am going to start us off here. So I am Dr. DeShawn Taylor. I am the founder and CEO of Desert Star Institute for Family Planning. As most of us, I wear several hats, but the hat that I'm coming to you today with is the person who runs the Desert Star Independent Abortion Clinic in Phoenix, and I am the primary provider there. And I've also convened our Arizona Proactive Reproductive Justice Alliance to advocate for bodily autonomy and abortion access for Arizonans. All right, so I'm going to go into introducing our panelists. We have Israel Cook, she, her pronouns, State Legislative Counsel on the State Policy and Advocacy Team at the Center for Reproductive Rights. Israel works on state legislative and policy advocacy across the United States. Israel tracks and analyzes state legislation and regulations affecting reproductive rights to support the center's clients and state partners. Proud to be a state partner of the Center for Reproductive Rights here in Arizona. And we then have Mackenzie Darling, who uses she, her pronouns as a reproductive justice movement lawyer, works on federal reproductive health policy, and joined our Arizona Proactive Reproductive Justice Alliance to further her work in protecting the right to bodily autonomy and fighting for decriminalization in her new home state of Arizona. Welcome both Israel and Mackenzie. And I am going to turn the floor over to you to give us a bit more of an understanding. What is Project 2025?
Hi, everyone. Thank you for having me, and thank you for the introduction, Dr. Taylor. Like Dr. Taylor said, my name is Israel Cook, and I use she, her pronouns. I'm legislative counsel on the State Policy and Advocacy Team at the Center for Reproductive Rights, and I have the pleasure of working with Dr. Taylor and Mackenzie on the Arizona Proactive Reproductive Justice Alliance. Also, disclaimer, I am in Brooklyn. There's a train next to my window. You might hear train noises. Also, I have a cat, and he is very loud and very needy. So if he pops up, I apologize. He probably will be a part of this presentation. So I'm here to do some introduction into kind of what Project 2025 is and how it implicates reproductive rights, health, and justice. And just a quick disclaimer, this presentation is meant to inform, educate. The center is a C3 and does not endorse or oppose political candidates. And my use of terms like conservative or Republican are only used in instances where I'm referring to or directly quoting Project 2025 sources. And yes, so I'm just here to level set, give us an introduction to Project 2025, and then how it implicates reproductive rights. And then I will pass it on to Mackenzie to also give us a little bit more of a deep dive into those topic areas. So what is Project 2025? Project 2025 is a large-scale and sweeping policy framework designed to further conservative policies in the wake of a Republican presidential election. The framework was produced by the Heritage Foundation, a conservative think tank that has been influential in guiding conservative projects and policies during many presidential terms. And more than 100 other conservative groups have contributed to the project. Many of the authors have extensive backgrounds in conservative politics, and many came to the work after the Trump presidency, with many of them being former Trump administration. Project 2025 is essentially a presidential agenda designed to roll back U.S. civil rights, consolidate power within the executive branch, and implement conservative policies across federal agencies. And just some signal posting that is in the mandate, there is a section called Taking the Reins of the Government, which is kind of indicative of what the policies will do. The largest publication, which you see on the screen, is Mandate for Leadership, a manual that is nearly 900 pages long, touching on almost every facet of American life, and has policy mandates for every federal agency. Just want to acknowledge that this is a lot of information. This is very sweeping and comprehensive policy suggestions. And we, like Dr. Taylor said, we have heard some of the top lines and some of the popular sound bites. And this programming tonight is just to kind of do a little bit of a deeper dive into Project 2025 and its implications for reproductive rights, like I said, and to kind of set the stage for our discussion and question later on. So what I'm going to cover is I'm going to cover how Project 2025 is targeting abortion access. And then I'm going to pass it on to Mackenzie to discuss how Project 2025 is attacking other areas of bodily autonomy, including increasing criminalization and surveillance, promoting the spread of misinformation and disinformation, attacking contraception access, and undermining reproductive health globally. And this is not an all-encompassing list. There are so many other ways in which Project 2025 is targeting reproductive rights, health, and justice. Again, this is just kind of a deep dive into a few. Another kind of quote from Project 2025 to kind of set our stage and understanding is that the project says that the Department of Health and Human Services should return to being known as the Department of Life by explicitly rejecting the notion that abortion is healthcare. In terms of reproductive rights, Project 2025 is looking to curtail and eliminate abortion access at the federal level. And one of the main ways it wants to do that is through medication abortion restrictions. And so there are mandates within Project 2025 to revoke the FDA approval of mifepristone. Mifepristone is one of two drugs in the two-drug regimen for medication abortion that has been studied and approved by the FDA over and over time again, and it's safe and effective for folks. And it's one of the main ways that folks access abortion in the United States. And so it is very critical. And the project is wanting to roll back access by revoking FDA approval, which was recently litigated. And the Supreme Court said that no, the FDA does not have to revoke the approval. And Project 2025 is going to continue to push for that revocation. The next is that Project 2025 wants to reinstate in-person dispensing requirements for medication abortion. And so pre-pandemic, there were restrictions that required medication abortion to be distributed and dispensed in person. And with the COVID-19 pandemic, there were ways that medication abortion access was expanded by allowing medication abortion access to be mailed, and to be able to use telehealth to provide medication abortion, which they want to roll back. And the last is that Project 2025 calls for the revival and the enforcement of the Comstock Act. The Comstock Act is an 1873 draconian law that looks to criminalize the mailing and the receipt of obscene materials. And obscene materials include anything that is intended to produce an abortion. So if Comstock is revived, it could be used to ban the distribution of medication abortion through mail. The next way in which Project 2025 is attacking bodily autonomy and reproductive rights is by limiting the use of federal funds for abortion care, by seeking to push Congress to codify things like the Hyde Amendment and the Weldon Amendment. And, you know, the Hyde Amendment and the Weldon Amendment are riders that are introduced every year and approved every year by Congress, but by codifying, it would put them in law. And the Hyde Amendment is used to limit the use of federal funds for the provision of abortion, except in cases of emergency life-saving abortions, rape, or incest. And the Weldon Amendment is used to allow things like insurance companies, hospitals, and providers to deny abortion services coverage and reimbursement if they receive federal funds, due to conscientious or religious refusals. The plans also include encouragement for the Centers of Medicaid and Medicare Services to attempt to disqualify abortion providers from coverage and reimbursement of federal funds for abortion care, and to eliminate federal funds for places like Planned Parenthood. The last thing that I'm going to cover before I pass it on to Mackenzie, which I have covered a lot and I'm going pretty fast, but we have a lot to get through, is furthering attacks on EMTALA. So there are calls for the further erosion of EMTALA, Emergency Medical Treatment and Labor Act. EMTALA requires that emergency healthcare departments that receive federal funds have to provide emergency life-saving abortion care to pregnant patients in crisis. And Project 2025 essentially wants to erode some of those protections, allowing these emergency departments to refuse to provide that care. And we have seen this happening in state cases like the one in Idaho and other EMTALA challenges, but we're going to continue to see that erosion with Project 2025. And now I'm going to pass it over to Mackenzie.
Thank you so much, Israel. That was a great overview over the attack specifically to abortion. And thank you so much for Dr. Taylor for inviting me to come join this conversation. So I'm going to talk about some of these strategies of Project 2025 to target other types of reproductive and sexual health care. So as Israel said, Project 2025 has a 900-page conservative master plan on how to attack people and their rights in a myriad of ways. One of the strategies to attack people is through increasing criminalization and expanding surveillance of people and their healthcare decisions. So Project 2025 seeks to worsen and expand criminalization of people who have had abortions. As Israel already mentioned, one of the ways they seek to do this is through the use of the Comstock Act to criminalize the provision and distribution of medication of abortion via the mail. By criminalizing medication abortion via the mail, Project 2025 can effectively create a de facto abortion ban. Project 2025 also seeks to push local and state district attorneys to prosecute more people by calling on the Department of Justice to take action against local district attorneys and prosecutors who've previously refused to prosecute some certain criminal offenses. So local and state district attorneys and prosecutors have discretion to decide what cases they do and do not want to prosecute. And a lot of more progressive prosecutors have come out and said that we aren't going to prosecute people for abortion care, pregnancy criminalization, and other and criminalize other forms of stigmatized care. And Project 2025 specifically wants to force Department of Justice to investigate and sue these district attorneys for not criminalizing and prosecuting these claims. So Project 2025 also seeks to gut federal protections related to health data privacy, including HIPAA. And they want to do this because it will ultimately make it easier for medical records to be accessed, that there won't be these federal protections to your data and to your health data, your personal health information. And so this information can be accessed easier and utilized by law enforcement to criminalize people who seek abortion care, for their pregnancy outcomes, and other forms of criminalized care, because they'll be able to access that personal health information. And then more broadly than just attacking people who've had abortions or other forms of stigmatized and criminalized care, Project 2025 also seeks to further criminalize and surveil people within marginalized communities. For example, a major aspect of Project 2025 are their far-right and extremely harmful anti-immigration policies that seek to further criminalize immigration status. These include mass deportation strategies, ending birthright citizenship, increasing family separations, and dismantling the asylum system. We'll get into this is a long conversation. There's so many different things in Project 2025 meant to increase criminalization and surveillance. These are just some of the top lines. So Project 2025 also seeks to spread a lot of mis and disinformation around sexual and reproductive health care in order to further worsen stigma and confusion about what care is accessible. One of their strategies for stigmatizing and delegitimizing sexual and reproductive health care is to change the Department of Health and Human Services into the Department of Life, as Israel mentioned, and establish an anti-abortion task force within this new department that is dedicated to pushing anti-abortion federal policies throughout all the agencies in the federal government. Project 2025 also uses charged, medically inaccurate anti-abortion rhetoric throughout all of their policies to falsely portray abortion as unsafe and to further attack abortion providers. And Project 2025 also seeks to redefine basic sex education as pornography and then seeks to make it illegal and ban it to prevent young people from accessing medically accurate sexual health education and information. And then Project 2025 also seeks to gut people's access to contraceptive care. One of their main strategies to bar people from accessing contraceptive care is to gut the Title X program, which is the nationally publicly funded family planning program that provides millions of people sexual and reproductive health care every year. Project 2025 wants to cut Title X funding drastically and prevent any provider, clinic, or program that receives Title X funds from providing, referring, or even consulting people about abortion care, essentially establishing a domestic gag rule, barring anyone who received these funds from even saying the word abortion to their patients or community members. And this is huge because Title X funded clinics are some of the only healthcare people are able to access in rural communities. And this will essentially force these clinics to either stop receiving funds and risk closing and no one having access to healthcare, or be completely barred from telling their community and their patients with a crucial, safe healthcare of abortion care. And then Project 2025 also wants to eliminate federal requirements that provide health insurance programs to provide no-cost coverage for contraceptive care, including emergency care. This will make it extremely more expensive for people to access contraception, even if they have health care, because it will no longer be required for private health insurance providers and Medicaid and Medicare from providing no-cost coverage for contraceptive care. And then Project 2025 doesn't just seek to restrict access to reproductive health care domestically, but also seeks to utilize the role of the US in foreign affairs and international care to restrict access globally. So they seek to do this by reinstating and expanding the global gag rule. The global gag rule prevents non-US, non-governmental organizations or NGOs that receive US government global health assistance to provide abortion services. Essentially, these organizations that work abroad, if they receive this money, they cannot provide or talk about abortion care. And essentially, Project 2025 wants to reinstate this rule and expand it to ensure that all US foreign assistance, including humanitarian aid, cannot go to an organization that provides abortion care or refers people to abortion care, making it essentially, if US dollars are touching it, they cannot touch abortion care, completely decimating some communities that really rely on this money to provide healthcare to their communities. And yeah, that is just kind of like an overview of some of the strategies of Project 2025. We covered a lot, and there's so much more in those pages, but these are just some of the really big threats to reproductive and sexual health care that Israel and I were able to tease out of that 900-page document.
All right, so we are going to chat, and I have some questions for our panel. And I also encourage you to, if you have any questions, if you look down at the bottom, there is a Q&A function. And so you can put your questions in there, and we will be sure to include those. We have some time for Q&A at the end. And so I have some questions, and I also want to show my slide to share my question because it's great. And so my first question that I want our panelists to answer is, reproductive justice calls for us to apply an intersectional lens to Project 2025. And so what are some other aspects of Project 2025 that we should be looking more closely at?
I feel like the incorrect answer is all of it, but it's a little too on the head, but a lot of it. So I think that I had mentioned previously that it had kind of set out mandates and policy guidelines for all federal agencies. And some of those things Mackenzie and I have touched on, but there's also things about ridding agencies of DEIA, diversity, equity, inclusion, accessibility initiatives, really eliminating labor and environmental protections, gutting the Department of Education. There's truly so many things, gutting voting rights and, targeting voting access. And I think all of these really contribute to that kind of that reproductive justice lens of being able to, exercise bodily autonomy and decision making, but also like raise your families in healthy and safe environments. And you can't do that if there's no labor protections. You can't do that if there's no environmental protections. You can't do that if you can't educate yourself for your children. I think there are a lot of, really big implications.
Yeah, I would absolutely second all of that. Project 2025 goes after everyone. That far right white supremacist ideals have always historically gone after. There's something within those pages that kind of attacks everyone. So we could spend the entire time talking about how harmful each page of that 900-page document would be. But I wanted to really highlight the attacks within there for LGBTQ plus individuals, families, and communities. So there's restrictions and bans against gender affirming care, including criminalizing people who help young people access gender affirming care. They want to completely eliminate transgender health care from Medicaid and Medicare, essentially ensuring that gender affirming care is not covered by these national healthcare plans, and completely eliminate LGBTQ plus rights within the law that have been recognized. As Israel said, they completely want to decimate anti-discrimination protections and specifically use really homophobic and transphobic language throughout the document to really attack LGBTQ plus people and their families and their communities. And then also, Project 2025 really wants to attack and terminate support of people experiencing poverty. It wants to eliminate federal healthcare coverage plans, including major funding cuts to Medicaid, the Children's Health Insurance Program, CHIP, and the ACA. They completely want to decimate food assistance programs, including SNAP, cut benefits to people living with disabilities, establish extremely strict limitations and restrictions on who can access affordable housing, and want to fully privatize healthcare, Medicare, making health insurance for seniors and people living with disabilities completely cost prohibitive. They just essentially want to ensure that people aren't able to access healthcare, aren't able to access any type of federal support or safety network, and really put everything back into the hands of corporations and that business profit lens that they're pushing. There's just a lot of harmful things in there.
And I'm just listening to all that, and it's everything that Desert Star does. We provide contraceptive care to people. We provide abortion services to people. We provide gender affirming hormones for adults. It is just, patients are coming into the clinic rightfully concerned, especially our trans patients, about what's in store for them, potentially the information that's in this document, and it is very scary. And so I am going to move on to our next question. And so that question is, this is a national plan focused on executive power and federal policies. What is the impact on state laws and policies? And specifically, what does this mean for Arizonans?
You want to go first this time, Mackenzie? Or do you want me to?
Sure, I'm happy to go first. I think the important thing to remember is a lot of the strategies in Project 2025 are not new. In fact, we've been seeing them play out on the state and local levels for a really long time, especially the reproductive and sexual health care attacks that we've seen since the decimation of Roe and the Dobbs decision. It's one of the reasons Project 2025 has gained so much traction is because we know that these strategies can work because they have been working in hostile states for a really long time. So everything within the Project 2025 framework can be adapted or it can inspire conservative and hostile lawmakers on the state and local level to take these attacks into their own communities. And I also think it's important to remember that federal policies impact the state and local level, especially the policies that would gut programs our communities rely on. As Dr. Taylor says, people within our community, people that go to Desert Star are relying on being able to access this care, that rely on these social support and safety net federal programs that are going to be completely gutted. So things that do happen on that federal level are going to deeply impact Arizona and our community members.
And I think you can hone in on any issue, but I mean, just think about like voting rights as well. Like when you disenfranchise voters at the federal level, it gives almost a carte blanche to states to be able to do the same. And I think that is in a way kind of similar to what will happen with other policies within Project 2025.
So it's important for us locally to really understand that without federal protections, which we're already seeing what happened with the abortion bans, then states people who make laws for states are not necessarily representing the interests of the people in the states due to gerrymandering, voter suppression, and all of those things. And so, the environment has been created where if there's no oversight and no accountability, then we can see like all of our rights taken away. And I don't believe that that's being hysterical. I think that's the truth of the matter. And so I don't think that any one of us is safe. Should what's in this plan make its way across the entire nation?
Yeah, I absolutely agree. And I would just add that we're seeing so much play out in the courts as well. And judges often aren't elected positions. They can be, but they're appointed positions by people in the federal government a lot of times. And they hold a lot of power and can make really harmful decisions that can impact people. We saw that in Arizona with the old abortion ban law that the Arizona Supreme Court wanted to revitalize. We see that with the Untala cases. We see the role the courts take a lot, and that this is a space where the federal government has a lot of power and can be weaponized, and that will only grow under these Project 2025 strategies.
And I will mention that in Arizona, our lawmakers have put a proposition on the ballot that will, if people vote for it, will take away our ability to say no to the judges. So our governor appoints judges, but we get to say, we don't want this judge to continue on the bench. And so if people don't quite understand how important judges are, people may very well go to the polls and say, yeah, sure. We trust our governor, and judges whoever they appoint can just stay there forever. And And that is definitely how minority rule will chip away and completely take away our rights, because you have these judges who have been appointed by people with this agenda, and they get to stay on the bench and not be removed. And so I have a third question that I want the panelists to address for us. And so we got a little bit of an intro into criminalization. And so what does this criminalization plan and Project 2025 look like in our everyday lives?
I can start and then turn it over to Mackenzie, who has provided information on this and probably knows a little bit more than I do. But I do think that it will be kind of an increase of what we've already seen, which is surveillance, monitoring, and reporting. And I think that if anybody has talked to me in the last couple of weeks, I have referenced Pregnancy Justice's new report on pregnancy criminalization so many times. But I think that we will continue to see the rise in pregnancy criminalization and the ability for prosecutors, police officers, and everyone to investigate and charge folks with crimes related to pregnancy. And I think that the calls for monitoring and limiting access by federal agencies will trickle down into states as well. And again, kind of like what we touched upon with past questions, really embolden prosecutors and attorney generals and police forces to continue to monitor, track, and punish folks for pregnancy outcomes.
Yeah, I absolutely second all of that. And I also had Pregnancy Justice's new report in my notes. Pregnancy Justice, for those who aren't aware, tracks the amount of cases of people being criminalized for pregnancy outcomes. And within that first year from the Dobbs decision, they found at least 210 pregnant people have been faced criminal charges related to conduct associated with their pregnancy, pregnancy loss, or birth. And that number is just going to keep rising. They constantly track cases. And additionally, if, when, how, another federal repro organization specifically tracks the criminalization of self-managing abortion care and found that between 2020 and 2022, there was documented 61 cases of people being criminalized for self-managing their own care. So this is not new. The threat of criminalization and surveillance is not new. We've been seeing it. Pregnancy Justice has been tracking this information since 1973. People are being criminalized all the time for their reproductive healthcare decisions, and Project 2025 is just going to worsen that. As Israel said, it emboldens prosecutors, police officers, actors of the carceral state to just further criminalize because they know that they have this support behind them for doing this. And I think another really big impact of the threat of criminalization is a cooling effect on people seeking out care. The confusion about what is legal, what isn't legal, what they can be charged with, if you help someone, when is that a criminal offense? All this information is really confusing. It's not clear. There's a lot of scare tactics being used, a lot of misinformation and disinformation being out there. So people are just not seeking care because they're scared that they're going to be criminalized, that they're going to face criminal charges. If they, get abortion medication through the mail and they live in a banned state, but their doctor lives in a state that protects, are they going to be protected under the law? There's a lot of misinformation about those situations. So I think there's going to be a really big cooling effect, and we are seeing that. And that's just talking about in that reproductive and sexual health care framework. But as we were talking about, like, Project 2025 attacks people for so many different care they seek out, choices they make. And so I think looking at it at the criminalization of reproductive health care gives really good concrete examples, but this criminalization and surveillance is not going to end with just criminalizing people for abortion care, but we're going to see it across the map: gender affirming care, immigration status, sexual education, book bans, and teaching about anti-discrimination and diversity. We're going to see this constantly, and we already are throughout the country.
And I'll flag too, I think something that I wanted to mention but forgot to earlier is that this kind of also this attack on free speech and the ability to protest, which is like a way in which we communicate our, displeasure and feelings and thoughts about current situations that we have to do outside of and in tandem with voting and talking to our elected officials and things like that. And I think that there is a real target on our ability to speak out against certain policies, and I think that that is going to continue to ramp up, and it is outlined in Project 2025.
Yeah, and so I ended up seeing something about the DOJ then being Department of Justice being weaponized against citizens who are protesting or speaking out against these attacks on our rights. And that's just such an overreach into our personal lives, right? And so I've noticed that we don't have any questions in the Q&A. Does anyone have any burning questions to ask our legal experts here? Of course, we're not providing legal advice, but does anyone have any burning questions or want our panelists to expand more on something that was said during the presentation? And if so, instead of using the Q&A, you can go ahead and put your question in the chat. And also, we can allow people to talk as well. All right, so we are then going to go on into our final thoughts and calls to action. And so I am going to, I am like hyper focused on voting. And one of the reasons is that I actually had the opportunity to be a civic health fellow with an organization called VoteER. And so I've learned so many strategies about how to engage voters. We've received tools to engage people in our clinic, in our surrounding areas, because what we are starting to understand is that voting is a social determinant of health. People's ability to exercise their right to vote and have an impact on the policies that impact their care and their ability to access care improves their health outcomes. And so I cannot stress enough, check and recheck your voter registration before the deadline to register to vote in your state. It is crucial for us to carry the mantle for marginalized people who cannot vote. And I did see something pop into the Q&A. We have a question: what factors contribute to reproductive criminalization having this snowball effect on the rights of other marginalized people? That's a great question. I'll read it again. What factors contribute to reproductive criminalization having this snowball effect on the rights of other marginalized people groups?
I can take a first stab. If I'm understanding the question correctly, I think that what we have seen time and time again, especially in banned states and southern states, is that criminalizing abortion is the blueprint for criminalizing other types of reproductive and bodily autonomy decision-making issues. And so you see this as lots of states that have started off with completely criminalizing and banning abortion have now moved on to transgender healthcare, are now moving on to IVF and fertility care access. Hospitals and maternal health care have been decimated. And so I think that you can see abortion laws that criminalize abortion are used as the playbook and the blueprint to then criminalize other aspects of a person's life. And then it just continuously affects the most marginalized. So Black folks, brown folks, indigenous folks, poor people, disabled folks, LGBTQIA folks, all of these are impacting those categories of people the most and are used to control, undermine, and kind of restrict bodily autonomy amongst those folks. And I hope that answers question.
Yeah, I second everything Israel said, and I would just uplift that also, like, a criminalization of pregnancy, of abortion care is not in a silo. It exists within mass incarceration and the attacks to marginalized communities, like Israel said, primarily Black and brown individuals, indigenous people, people living in poverty and experiencing housing insecurity. These communities are most often attacked and criminalized by our carceral state, and attacking a bodily autonomy, abortion, pregnancy outcomes is just another strategy to further that carceral mission. So we're going to continue to see that the criminalization of abortion. Yes, I agree with Israel that it is a roadmap for so many other ways to criminalize care, but it's also not the starting point. People have been criminalized for drug use forever under the war on drugs, and a lot as pregnancy justice really looks at the criminalization of substance use during pregnancy. The reason that really blew up and how they could criminalize people for their pregnancy outcomes is because our system was already designed to criminalize people for substance use, and they were able to build off of those strategies. So criminalization is all directly interconnected and is so deeply rooted that this attack on reproductive criminalization is just a tentacle of this system, and then we're just going to keep seeing it grow and grow and continue to attack people who are most at risk of criminalization.
I will add that people's complex feelings about abortion have been weaponized to help people who have these ideas in mind to gain power and control. And so, quite honestly, when we think about the magnitude of what we're seeing at this time, the magnitude of what we're seeing is possible because Roe v. Wade fell. And the conclusions that the Supreme Court came to when they overturned Roe v. Wade opened the door for so many other decisions that were handed down because of that reasoning, the right to privacy. And so and then we were able to see this happen because, again, it was a well thought out and planned narrative that was created over the course of several decades to change public opinion, to weaponize people's religiosity, to create a pathway to not resist when all of this stuff starts to come down, because now it's a moral issue. Now it's a partisan issue. It's not healthcare anymore. People don't believe in it. People vote against it. And so then you open up the door for what Israel mentioned as the playbook. The tax on trans rights is rinse and repeat of what was the early beginning of the attack on abortion rights. And so I think what's really important is we really want to have one-on-one conversations with the people we care about in our lives and really help people connect the dots about criminalization and what it looks like. Because it doesn't matter what someone's deeply held beliefs are. I like how our, I can't tell you who to vote for, but I can say that our Vice President Kamala Harris has been on point with the message. It resonates with me when we say you do not have to, go against your deeply held beliefs to understand that the government should not be legislating what people can do with their bodies. And that goes beyond people's ability to access abortion care. It goes into all the different aspects of our lives that are currently under attack. Should we allow Project 2025 to go forward? Thank you for that question. That was a really good question. Do we have any others? Okay. And so we will go, I have Mackenzie's call to action next.
Yeah, I second Dr. Taylor's call to action to register, check your registration status, and to vote. But also, if I can leave you with one message from this webinar, is that what is proposed in Project 2025 really isn't new. We're seeing this on the state and local level. People are actively fighting against these harmful attacks every day. So I really encourage you to support your local abortion funds and independent abortion and healthcare clinics, whether that's financially, whether that's volunteering, whether that's organizing fundraisers, whatever works for you in your life, but supporting the people on the ground, ensuring that no matter what, people in your community are able to access care is so crucial. So take time tomorrow after you check your voter registration status to just look up what is your local abortion fund, what is your local indie clinic, and how can you best support them and show up for these people on the ground doing this work every day.
Thank you, Mackenzie.
Yeah, and my call to action is usually support your local indie funds and clinics. But since Mackenzie already said that, I think what I am going to ask people to do is to really use what you learned today. And any time that you attend a session that Dr. Taylor or someone else has organized, take that information and spread it in your community to combat disinformation. I think that regardless of your political views, who you're voting for, what you believe, what you don't believe, I think that combating the misinformation is so important, and that like my ability to share information with you, I'm hoping that you will in turn share that information with someone else. And yeah, that's my call.
Well, I want to thank you both so much for joining us. This was such an informative discussion, and I want to thank everyone for joining us. Thank you for spending an hour of your week night with us, and I hope that you found this information worthwhile, and we'll stay tuned for our next virtual educational session.